So there are growing calls to follow the money on Obamacare. A top Republican lawmaker is set to introduce a bill today that's aimed at keeping track of the $1.8 trillion taxpayer dollars. Look at that number. Don't you think it might be a good idea to keep track of where it's going? The congressman introducing this bill is Illinois Republican Peter Roskam, and he's the chief deputy whip and joins me now. Congressman, welcome. Good to have you here today.
Thanks, Martha. Thanks very much.
I think a lot of people would listen to that and wonder why nobody thought of this before you.
Well, special inspector generals are very, very important, and the history of them is significant. We've had them for Afghanistan, we've had them for Iraq, we've had them for TARP, the Toxic Asset Recovery Program, and cumulatively, they have saved literally billions of dollars. So it doesn't, it kind of begs the question, if you've got a program that's going to cost $1.8 trillion, why wouldn't you put that same oversight, particularly in light of an administration that has not been forthcoming and has been very political in their operation? Let's get to the details of what's actually going on, because the American public clearly has a right to know all of the facts.
I mean, who is keeping track of where the money's going currently?
Nobody, and that's my point. So the Obamacare as a program goes across all sorts of federal agencies and commissions, and there's nobody that is really tasked with singularly tracking the entire program. So you've got a special inspector, you've got an inspector general for HHS, you've got an inspector general for other different agencies, but nobody's looking at the entire program cumulatively. And what we're saying is, no, you need one person, one entity that has that responsibility to gather all this data, to report within 120 days of enactment, and then report quarterly to the public on what's going on. And if they find out that somebody is not being forthcoming about the information, they've got to report that as well. So if somebody says, well, that we're not going to disclose that, okay, we're going to disclose the fact that you're not going to disclose that and have a general discussion about it. Look, it's high time that we get to the bottom of this, and the administration doesn't get the benefit of the doubt at this point. It's a highly political administration that is clearly making decisions in part based on their political agenda and their timing and so forth. And I think enough is enough. Let's get to the bottom of it.
Yeah, I just think it's shocking when you think about the fact that a lot of people are losing their health insurance, or their premiums are higher than they used to be, so they're having to pay more in that regard. Now they have to pay for the messy bureaucratic system that put it into place because nobody's keeping track of where the money's going. We just spoke earlier about Oregon. They got $314 million basically to create a website that allows people to connect with each other. Honestly, I don't know why that costs $314 million in the first place to you.
Here's why. I'm from Chicago, and you know what that is? That's an old-fashioned hustle. $300 million that benefits nobody in Oregon, nobody in the United States, except somebody who's connected or it's supplementing incompetence and so forth. So $300 million in the context of $1.8 trillion is a small proportion, but it is a huge amount of money, and we've got to get to the bottom of that. And here's the thing. These have worked in Afghanistan on a bipartisan basis.
Let's put the numbers up. Excuse me, Congressman, but we have the numbers about what was spent in these Attorney General reviews in the prior examples that you gave. There's a look at Afghanistan, 102.1 billion, and you can see the numbers there. TARP, Katrina. In all of these cases, Inspector General oversight was implemented, and the administration was very much in favor of it. So it is quite surprising that they wouldn't want there to be accountability, because why would they want this money to disappear?
Well, that's probably another story, but when it all comes down to it, we've got this opportunity. And to your point, look, President Obama, when he was in the United States Senate, was voting in favor of special inspector generals for other elements of the federal government, programs that, quite frankly, were smaller, that were embraced on a bipartisan basis.
And are they going to be supportive? I'm sorry for jumping in, but what's the reaction that you're getting to this so far? Are you going to get anywhere with it?
Well, we're breaking the story with you right now, and then when we continue to roll this out, I hope that it will enjoy bipartisan support, but I'm not holding my breath. I think that the administration that hasn't been forthcoming is likely to take a low view of this. But I think that any straight-faced look at this, Martha, says, look, this is a reasonable approach. It's modeling on what other special inspector generals have done, and it's applying it to a program that dwarfs them by comparison. $1.8 $8 trillion.
Let us know. Will you come back and let us know? Okay.
I will.
Thanks, Peter
Thanks.
Roskam. Good to talk to you
Unbelievable.
today.
I mean, real.